So if we're looking at OA flexion, and again, the options that came up were, I can take them to the barrier, and then I could oscillate, and I could do it the same way that I'm doing it with, that I used to assess the dysfunction or the hypomobility. So that would work just fine that way. You could also take them to that barrier and then ask them to do, as we said, a gentle extension. But where do we want the extension? What muscles specifically do we want to activate? The suboccipitals, of which there are 8, correct? And you all know all of them. So what instruction would I give my patient to try to get them to selectively activate the OA muscles and not all of the long extensors? Right, you can say untuck your chin or gently poke your chin up, something like that. Or if you want to give them a tactile cue, I can take them into a position where when I engage the barrier, I'm going to hold there and then come here and then just say really gently, I want you to just gently push your chin up, really gently, and relax. When he relaxes, I relax, and then I take him into a little bit more OA flexion. That's one option. Another option that, again, you could use as a treatment as well as an assessment would be this notion of trying to say, okay, I'm going to attempt to stabilize C1 and C2 together and then move occiput relative to them. So if my patient is lying in this position, can you grab me a spine, please? Thank you. So if my patient is lying in this position, I can take my web space, come underneath the arch of atlas and C2, and just do a little bit of a pinch there to stabilize, and it'll make a little more sense when you see my arm will be kind of supported on the table. My other hand is going to come up around the occiput, and then my shoulder is going to be over their forehead, and then when I do the technique, it's going to be, I'm just going to kind of stand up a little bit, and as I'm pushing down with my shoulder and pulling back on their occiput, I get a nice flexion moment. You know I have to tell this story, don't you? He's just waiting.
Tell the story.
So Scott and I have taken a lot of manual therapy